What a brave member of Congress. I love that video. So I'm sitting here with some people, again, that I really admire. So, Will, I get to start with you, which I often do. And I'm wondering if you can go ahead and set the stage and tell folks why the National Strategy on Hunger, Nutrition, and Health, why it was imagined, what it is, what it does, and why are these issues so important to the current administration?
Yeah, absolutely. And I'll start by saying it's really tough to follow Admiral Levine because she did such an incredible job laying out why this is such a priority for President Biden and for this entire administration, and really the excellent work that HHS has done in this space since the White House Conference on Hunger, Nutrition, and Health that President Biden hosted in September of 2022. So folks may know that that was the first time that the president has hosted a conference on these issues in over 50 years. And we convened that conference in September of 2022. In addition to that conference, the Domestic Policy Council, my colleague Kelliann Blazek, is our Special Assistant to the President for Rural and Agriculture Policy, worked with all of the agencies across the federal government to develop a national strategy on hunger, nutrition, and health that really provided a roadmap for some of the federal tools and resources that could be utilized to help achieve President Biden's goal of ending hunger and reducing diet-related disease while addressing disparities amongst communities by the year 2030. So an ambitious but achievable goal. But obviously, that's not a goal that we can achieve with just federal action alone. We need all of the people in this room. We need state and local officials across the country. We need the private sector, food and health sectors, community-based organizations, nonprofits, farmers, agricultural workers, farm workers, everybody working in tandem and lockstep to help us achieve this goal. And so that's why ahead of the conference, the White House worked with the CDC Foundation. Dr. Judy Monroe, who joins us here, and her team did incredible work alongside the White House and HHS, USDA, so many agencies who worked with many of the stakeholders we just talked about, both to help inform the national strategy that we put out, but also to develop external commitments to help us achieve the president's goal. And so ahead of the conference, we announced over 60 external commitments aligned with the president's goal. Post-conference and after releasing that initial round of commitments, we heard from so many different stakeholders who said, hey, if we had a little more time, we might be able to provide a commitment. We might be able to do something a little bit more. And because we wanted to give folks more time, we announced the White House Challenge to End Hunger and Build Healthy Communities in March of 2023. And over the past year, up until a couple of weeks ago, when we hosted an event at the White House to announce those commitments, we've worked with so many folks here in this room. We've worked with Food Tank. We've worked with so many excellent stakeholders across the country to develop more commitments, to really galvanize additional support and additional actions that folks outside the federal government could take to help us achieve the president's goal. And just 2 weeks ago at an event at the White House with the second gentleman and Secretary Blazek, Admiral Levine, and so many others, we announced 141 new external commitments totaling about $1.7 billion. Thank you. And so we were really excited to announce those commitments and lift up that work. Again, we did this work with the CDC Foundation, and Dr. Monroe will talk a little bit more about kind of where those commitments go from here, the work they're doing with commitment makers to foster those commitments. And of course, and Admiral Levine spoke to this as well. I'll leave Kelliann to touch on this too. We've been working really hard to implement the National Strategy on Hunger, Nutrition, Health that we announced, that we lifted up at the conference.
Yeah.
And I know Kelliann will touch on that as well.
Well, one thing that excites me so much is you do have this roadmap now, that is the legacy, part of the legacy of this administration, and it's so exciting to me. And again, I want to thank you all for putting that in place because it will help future administrations, no matter who they are, do this kind of work. So thank you. Round of applause for that, please. So Judy, if I can turn to you, Will mentioned that, the White House Challenge to End Hunger and Build Healthy Communities was launched. They've worked closely with the CDC Foundation to encourage new commitments in support of the challenge. What is the challenge? What do you want folks to do? What comes from this call to action?
Yeah, so thanks, and happy National Pie Day. I don't know if anybody said that yet. I thought it was very clever to schedule it on today. So the White House had 5 pillars with the challenge, and so under each of those pillars, we worked closely. The CDC Foundation worked very closely with the White House and partners to rally commitments under each of those 5 pillars. Are you going to go over the pillars? So let me quickly, just so you know the pillars. So it's improving food access and affordability. Second is integrating nutrition and health. The third is empowering all consumers to make healthy choices. Fourth is supporting physical activity, and fifth is enhancing nutrition and food security and research through research. So we started. We think of it as a big tent. It was broad. It was cast broadly for commitments, and commitments started to come in from large national organizations all the way to small community-based organizations, and everything in between under each of those pillars. And so there's some pretty exciting, and I think remarkable commitments that have been made. But a commitment is just a commitment, right? A commitment really translates when it is delivered upon. And so one of the things that the CDC Foundation has done is we've been tracking and asking folks to report back on what their commitments are. So that's part of the area. But we've got commitments. So, example, like the Rockefeller Foundation and American Heart Association committed. I think they're going to raise $250 million for research. Food as medicine has really taken off. We can talk more about that maybe later. And so we need the research there. But there's commitments in innovation. I think we'll talk a little more about that. But we've got data systems that are being unlocked. Partnerships that have never been thought of before. So one of my favorites is the National Association of Chain Drugstores. They found the Milk and Feeding Change group, and the two of them now are forging a massive, large-scale effort to get pharmacists to be involved in food as medicine and the prescription. So we could talk all day. There's a lot.
Well, I do understand this point of partnerships and collaborations. None of this would have worked without partnerships and collaborations, and the CDC Foundation has been a huge leader on that point. Not good, not easy work.
No, it's not. And well, so if you don't, the CDC Foundation, we're an independent nonprofit created to support CDC and public health, and so we work across administrations. I mean, we're here throughout. And our tagline is "Together, our impact is greater." And we were actually formed by Congress to forge public-private partnerships, but it is not easy work.
Can I just pause and say, Judy seems very nonchalant about the work that the CDC Foundation does. They are incredible partners. We would not have been able to pull off the White House Conference on Hunger, Nutrition, and Health or the White House Challenge to End Hunger and Build Healthy Communities without this partnership. They are doing incredible work. So I just want to acknowledge Judy and Sharon and Colleen on her team. They have been truly incredible collaborators to us, and we would not have been able to do this without them. So
it's incredible. Thank you, Kelliann, for mentioning that. Tina, if I can turn to you, I'm really excited. I'm very personally excited about how the President's Council on Sports, Fitness, and Nutrition is helping to support the national strategy. And I'm wondering if you can talk about it, because it brings some really cool athletes and young people together, and how that's promoting the health of communities.
Well, first of all, I wanted to say thank you for allowing me to be a part of this. First time I've attended one of your conferences, so
thank you.
I see a lot of enthusiasm here, and it's great to see. For some of us of a certain age, you're probably familiar with the President's Council on Sports, Fitness, and Nutrition. In the first meeting I attended, I was not aware. It did not happen in my school when I was growing up. The challenge that a lot of people, a lot of kids participated in. on my flight here, I was preparing for this because I'm still a student, I guess, and I'm worried about exams. And someone noticed what I was reading, and he said, "Oh my God, I remember taking that challenge as a kid." So it's something that's in, you know, a lot of people's heads. The challenge, the council is appointed by the president, is close to 30, full capacity is 30 members, we have 29. The co-chairs are Jose Andres, and I want to stress Jose Andres because—
Shout out for Jose.
that will tell you, give you a sense of why we focus so much on nutrition. And Elena Deladon, who's a fabulous WNBA player, MVP, et cetera. And if you saw the people who are on the council, it is made up of chefs, nutritionists, physicians, Olympians, Paralympians. It's people who care about fitness and health and understand that fitness, health is all tied to food, nutrition, how you treat it, how you look at it, how you involve it, how you incorporate it as part of your life. So when we were organizing ourselves and talking to Will, we looked at sports, and I did in particular because I'll admit it here, my life is sports. Even though I don't play a single sport, I'm a very avid watcher and participant. And we thought this is an instance in which the sports leagues, which individually are doing things around nutrition.
Right.
One of our members, a former pitcher for the Phillies, said to us on a call when he started in baseball, not many of the teams had nutritionists. They all do now. They all talk about food. They all talk about health and how that makes you a better athlete. And so we thought we would approach the leagues, who were always involved with the President's Council in one way or another, to actually formally join us in promoting nutrition. We didn't ask any of them to reinvent the wheel, but we say you all do programs that involve young people. You have youth programs. Can we make sure we're incorporating information about nutrition, that we're having nutritionists there, that we're talking about this, that we have a way that kids learn that to be their best on the field is they have to fuel their minds and minds and bodies. And I will say that one of the leagues in particular said, we're doing this work, we really care about it, we want you to also incorporate a discussion of mental health, which I thought was great, because this is something that so many young kids deal with. And that's something we've been able to do. I will mention one thing in particular at the meeting that Will referenced. I don't know if you remember a young woman, her name is Monet Davis. When she was 13 years old, she was playing Little League baseball, pitching. She was the first woman, first girl, to pitch in a Little League game, and they won in a shutout. She's the first girl to do that. She spoke, and she spoke so eloquently about how much sports had meant to her and for her, but also what she learned about what she needed to do about nutrition, what kind of food she needed to eat, that she spent so much time eating fruits and vegetables, that she wanted to be the best she could be as an athlete, but that required her to know as much as she could about the food she was putting in her body. And she had actually introduced the second gentleman. And I will tell you, she wants a career and was pursuing a career. She knew at 8 years old. She said maybe baseball broadcasting. And she's now at Columbia in their School of Journalism. But it's those kinds of stories that we want to work with the leagues and everybody else who will work with us to promote nutrition, to promote the understanding of taking care of your body as an important part of being the best you can be in whatever job, whatever pursuit you have. So it's been really great. All the leagues have been great. And I will mention the NBA at their All-Star weekend. They did a 24-hour, round-the-clock. You signed up for times to pack meals. They packed 1 million meals to give out to the community there for that weekend.
If I could jump into, Tina touched on this, but this is really the first of its kind partnership between the President's Council on Sports Fitness and Nutrition and all the major sports leagues and players unions. And really, again, incredible thanks to Tina for her leadership on this and the rest of the President's Council. The President was very, when he appointed the President's Council, he made sure that, as Tina mentioned, we had athletes, but we also had chefs, nutritionists, folks that were public health experts, folks who get stuff done like Tina Flournoy, and we're already seeing that paid dividends for us through this partnership. So we're really excited to see how this continues to foster as the leagues continue to work with the President's Council.
Thank you very much, Will. And I wanted to mention that we now are we have 16 MOUs signed by the leagues, and it was very important to us that we had the leagues and their players represented, their associations. So we're pretty excited about it.
It's fantastic. Thank you. Tina, if I can just stay with you for a minute. One thing that struck me about being at that White House event a few weeks ago now is that some of the athletes who spoke came from marginalized communities, yet they realized the importance of nutrition and what they needed to do and how to get it. It's really, really important for young people to see people who look like them, people who came from the same places they came from, to have that as an example. And so I just want to commend you. I don't know if there's a question there, but I'd love you to comment. I just want to commend you, though, for bringing those folks in.
Well, thanks to Will and DPC and everybody who participated in it. But there is, in life, really, if you want to achieve anything, there has to be a degree of intentionality. Especially when you want to make change, there has to be intentionality. So we were thrilled about that, thrilled to hear their stories, and that's why I wanted to mention Monet Davis and say, first of all, it's still a big thing. She's the only girl who's ever done this, and she's, all of them, the entire council, they're all very dedicated and focused.
And I love that she's going into journalism when she ended on that point. That was the greatest. Go ahead, Kelliann.
I was just going to add, I think, I just wanted to mention from the beginning of the process of this administration putting together the White House Conference on Hunger, Nutrition, and Health, and the White House challenges being mentioned, we made it a big priority to ensure that individuals with lived experience were guiding all of these efforts. So even before the White House Conference, we had meetings and roundtables with folks with lived experience to really understand what their priorities were and to listen. This president is very focused on listening and learning from folks in underserved communities and really folks across the board. And so that was a big priority. We partnered with different organizations at the White House Conference to ensure participation from folks with lived experience, and that has continued on through our work with the White House Challenge, so I just wanted to mention that.
Thank you so much. I think listening and intentionality have been huge sort of markers of this administration. Kelliann, I want to stay with you because in addition to the challenge, I want you to talk about a little bit, if you can, some of the policies that can help us achieve the goals that are laid out in the national strategy.
Yep, so Admiral Levine mentioned a whole of government approach. How many people know what whole of government approach means? We say it all the time in DC, but essentially we're just bringing the full force of the federal government, right? So we have over 20 federal agencies that we work with all the time on these issues. I wanted to really hone in on our work to advance healthy school meals for kids. How many folks ate school meals when they were growing up? Okay, most people in the room have their hand raised. Keep your hand up or put your hand back up if you enjoyed school meals. You thought they were tasty. Okay, we had some hands come down. So we're really working to change that. There's over 30 million kids who eat school meals every day, and so it's a big, big opportunity for us to impact the next generation. USDA actually has a forthcoming final rule coming out this spring that's going to advance higher nutrition standards. That proposed rule actually had what would be the first ever added sugar limit. And so we're really trying to make sure that kids are off to a healthy start, that they can get healthy, tasty food in schools. And so we're looking forward to that final rule coming out this spring.
So I'm wondering if you can talk a little bit about some of the programs that are in place to make sure that kids get fed healthy, delicious stuff. Some of the other things that have been laid out by the administration. What can we do to make sure that those things are protected no matter who's in office?
Yeah, so that's a great question. I think WIC is a great example. So the administration had been pushing for full funding for WIC for the last, I would say, 6 months, and making sure that in the FY24 appropriations package, and I'm saying this, and I realized that this morning, I think we started the day with someone saying policy is a black hole, and so I'm trying to make it demystify it a little bit here, but I apologize if it gets wonky. But we were pushing for full funding for WIC. There was an incredible advocacy campaign from stakeholders that supported our request for full funding. That was included in the package that recently came together, but we could not have done that without the support of stakeholders. The president's budget just came out earlier this week for FY25. In that is a WIC funding request for $7.7 billion. And so we look forward to continuing to work with Congress and all of you to make sure that we get full funding for WIC again.
Thank you so much, Kelliann. Tina, if I can come back to you for a minute, I think one of the things that excites me about the work that you're doing with major sports leagues is that it brings these different audiences, right? People who are Republicans and Democrats and everyone in between, but who love sports and want to follow the examples of sports figures that they idolize. It's a really ideal setting for that kind of message, but it's also a little bit political, and I wonder if there will be challenges for you and others as that sort of, as things evolve and change.
Well, to make a blanket statement, and I think everybody in this room knows, whenever you take on something, there are challenges. Thus far, in working with the leagues, and I know that some of their representatives are, some are of a different political party than I am, but it has never come up as an issue. Thus far, it's never come up as an impediment to anything. I think, first of all, they want to have more people involved in what they're doing, and they want to be successful, and doing this and doing it well is part of being successful.
Yeah.
So things kind of align, but there's been no pushback, no disagreements, and anytime we've called them, they're going to be involved in the Easter egg roll, at the White House. And I mention that because that's the largest event the White House does. It attracts 40,000 people.
Sure.
So as part of that, you see the Easter egg roll on the South Lawn, but there's a whole back part that deals with physical fitness, and they're going to be involved in that. So, for some of them, the role may be a little different, but nobody said no. They said, let's figure it out.
Sure. I mean, I think I asked the question in a clumsy way. It's such a great example that, other folks, should be following, that it doesn't matter, that this is something that all of us can get around no matter what sports team we like or what, political party we like.
Yeah, I think that's true. And I'm going to give Monet Davis more press than she's probably ever wanted. But I think this kind of sums it up, and it actually made me think of why you're all here and the work you do. And as she said in an interview, this world is huge and there's so much space for everyone to do something great. And that's true.
Thank you so much. Will and Kelliann, it's not only these external partnerships with the private sector, philanthropy, and civil society that are important. I wonder how, if we can go back to the different federal agencies that Admiral Levine mentioned before, why it's so important that they're now working together in a way that they never worked together before, which is so exciting to me.
Yeah, I appreciate you saying that. And a lot of this work is happening very behind the scenes. And so I wanted to mention a call that Will and I put together monthly with stakeholders who care about hunger, nutrition, diet-related diseases, and public health. We try to get a rotating cast of characters on that call from across the federal government. And so sometimes we have partners from SBA or National Park Service or Department of Transportation. And so please come and say hi to Will and I after this. We're happy to get your contact info. We have an open door policy, so please come up, say hi, and hopefully we can learn more about what you do. But I did want to mention, actually just yesterday, the president was in Milwaukee, Wisconsin. Do we have any Wisconsinites in the room? Thank you, Michelle. I knew you had my back there. I'm a Wisconsinite, so I appreciate that. But he was in Milwaukee yesterday announcing $3.3 billion in new awards through the Department of Transportation's Reconnecting Communities and Neighborhoods program. And that program is funded by the Bipartisan Infrastructure Law and the Inflation Reduction Act. And some of those awards are actually going to support critical infrastructure in communities to help improve food access, so to help folks get to grocery stores, to help folks be physically active in their communities through walking paths or bike lanes. And so that's not a traditional, USDA or HHS program per se, but it is really important in the context of the entire ecosystem that we're trying to build here to support the president's goal of ending hunger and reducing diet-related diseases by 2030. So that's just one example. The national strategy has equities across 20 federal agencies. The Domestic Policy Council is actually tracking each one of those commitments that the federal government made in the national strategy and working directly with those agencies to ensure that there's progress. And so I just wanted to mention that, because again, sometimes it's all happening behind the scenes, but we're trying to do a better job about highlighting some of those agencies that may not be the usual suspects like USDA and HHS.
Yeah, it's very exciting. Will, anything to add there?
Yeah, I would just add, because I know Admiral Levine covered everything, all the amazing work that HHS is doing. Just a couple work streams that USDA has led on that are really critical right now. So Kelliann mentioned the Healthy School Meals Rule. In addition to that work, they've done a lot of incredible work through the president's leadership to expand access to meals to both during the school year and outside of the school year. So they've worked to expand community eligibility for free and reduced meals through the schools. They've finalized a rule that expanded school meals to 3,000 additional school districts. And then because it's so critical for students during the summer months when they're not getting those meals to have access to food at home, the president signed into law a piece of legislation that actually allows for a new program that has been set up by USDA in recent months that allows for a new benefit for students during the summer months to access electronic benefits transfer funding, so EBT funding during the summer, an additional allotment that allows them to buy groceries during the summer months when they're not getting those school meals.
So important. Everyone, round of applause for that, please.
Absolutely. And so already this program has been taken on by 37 states, every U.S. territory, and 3 tribal nations, which will help benefit 21 million kids this summer. But every state is eligible, and we would love to see all 50 states utilize this funding. And so some states are looking already at 2025. USDA has been doing a lot of work with states and with tribal nations to ensure that they're able to apply and can access this funding for 2025. But this is kind of, I think, an important thing for folks in this room to keep in mind as you're talking with folks in your communities. Texas is one of the states actually that has not taken this benefit for 2024, and so we hope that they will look into this for 2025, because there's 3.8 million children who could benefit from the summer EBT program if Texas were to apply for 2025.
Right. Kelliann?
Can I just add on? I appreciate everything you said, Will, and I'll just add on kind of like a hopeful story or something that makes me really hopeful. So the USDA worked closely with states to increase uptake of summer EBT for this summer in 2024, the first summer that it's being offered permanently. And there were some states who in the fall said, absolutely not. We're not in a place to do it. There was a 50% admin match, so states had to chip in 50% of the administrative costs to run the program. The federal government is paying for all of the benefits. So some of the states were like, we just can't figure it out on this timeline. Some states politicized it. This should not be a red or blue issue. Feeding kids in the summer is just a no-brainer. But I'll just mention that some of the states that said, no way, we're not offering it, one was Nebraska, and the governor said, we're not doing it this year. And there was an incredible campaign led by advocacy organizations and stakeholders, community-based organizations in Nebraska that stepped up to the plate. And even though the governor kind of drew a hard line, they went in, they talked about how important it was for kids in their community. Kids themselves who were experiencing hunger went to his office and talked about their lived experience. And he actually completely changed course. And so about a month or two ago, he announced publicly at a press conference, he said, I was wrong, and this should not be a politicized issue, and we're gonna opt in for 2024, which honestly made me incredibly optimistic. I know there's some dark days in DC where we're all like, what are we doing here? But your voice really matters. Like, that's the point of that story, is that everyone's voice in this room matters. You can make a difference, even when it looks like there's a hard line on something and somebody in leadership is telling you no. There's always a chance they can switch gears. And so I just wanted to share that story.
It's such a great success story. Thank you. Gives me so much hope. It's so exciting. Judy, if I can come back to you, because the CDC Foundation really focuses on innovation and the importance of innovating. And I feel like that for all of this work needs to happen more and more. What does that kind of innovation look like for you?
You know, for starters, I would say you've heard a lot about whole of government. We need whole of society. And we need innovation to activate and unleash whole of society. Because everybody has a part in this. As we've said before, hunger, food is so important, right? Food is love, food is culture, and so we all need to lean into that. So innovation to me is quite broad. At the foundation, when we think about innovation, lots of folks immediately go to tech, right? We go to the tech innovations, but there are innovations in human relationships and human interaction and interconnectedness. And so at the foundation, we look very holistically at innovation. A couple of things that are coming out of the commitments that have been made. Universities here in Texas have taken a look at food insecurity in their students and faculty, and what they found is a SNAP gap. So there's an innovation now taking place in universities to help students understand access to services and benefits that they qualify for, that before it never happened. So to me, that's an innovation, right, that's taken place. So it can be high tech, low tech. We need high touch for sure in innovation.
It's really exciting. For my final question for you all, and I know I've done this a lot this morning with panels, I do want to know what your call to action is and what you want everyone in this room and communities around the country and folks who are watching online, what do you want them to sort of take away? What should they do? So Tina, if I can start with you.
Well, you know, it starts, you don't have to do a big thing, but everybody can do something.
Right.
I've recently gotten a new friend. She's 9 years old, and she's a big sports, women's soccer, and now football. I won't tell you why, but you can imagine why. Football has become. But she is now, her grandfather said she's of an age, she's making her own breakfast in the morning, but she has a list, and she has it in different categories of here's a protein, here's this, here's that. It seems very small, but at a very young age, she's being taught a very important lesson, one, how to make your own breakfast, but what foods you should be eating, and she's now going to tie that as well to, I want to play soccer, I want to do this, I want to do that. So it really is doing it at the beginning and as early as you can, teaching kids about this, and then it's finding partners, finding people who share the same sense of what's important, who are willing to work for you. And don't look at a partner and think, or a potential partner and think they may not be a partner. Give everybody the opportunity to be a part of improving things.
Fantastic advice. Thank you, Tina. Judy, call to action.
Yeah, call to action. So the CDC Foundation has formed, we're the backbone of a national action collaborative for hunger, nutrition, and health. So you can come to impacthunger.org. You can see commitments that have been made. You can see the pillars. But what we really want to do is have folks inspiring one another. We want to lift up the work that everyone is doing. I think of inspiration as the fuel for action. And so that's our call to action.
love
come
it.
be inspired. Come join us.
I love it. Thank you. Kelliann?
I will again say that we would love for you to join our monthly calls. We would love to stay in touch. Please feel free to reach out anytime. We learn an incredible amount from folks who are actually doing the work on the ground every day. I mentioned I'm from Wisconsin. I grew up on my family's farm there. I frequently go back to Wisconsin and learn an incredible amount of information and just success stories, what's working, what's not, that I bring back to DC. And so this only works if we're getting stories from the ground about challenges and opportunities. So please just stay in touch. And then a special call to action for young people throughout this kind of entire process at the White House Conference, at the White House Challenge event. We've made sure to engage young people because they're the future and we really need your ideas and creativity and inspiration. And so I hope that young people get engaged in this too.
Thank you so much, Kelliann. Will, you get the last word.
Awesome. Well, first of all, we're just blown away to see the interest in these issues here, and thank you for being here and being present, and we look forward to learning from you, as Kelliann said. We hope you'll sign up for our newsletters, our calls. I think if you go to whitehouse.gov/hunger health conference, or whitehouse.gov/hunger health conference, the email update link is still live there. We can also push out information through Food Tank, but just wanted to echo what Kelliann mentioned earlier about the importance of advocacy and advocating and really educating your communities, both on the work that is happening and the benefits that folks are eligible for. So if you're in one of those states that's eligible for summer EBT, ensuring that folks in your community are aware of that option, as well as WIC and SNAP and some of the other federal opportunities, but also continue to educate and advocate within your communities about some of the tools that we know can help address hunger and reduce diet-related disease. One of the pieces, Kelliann mentioned the president's budget that was released earlier this week. So that's kind of his budget and the requests he's made to Congress and outlines his budget priorities. He often says, if you want to see someone's priorities, let's see their budget. And in his budget, as Kelliann mentioned, increased funding for WIC to ensure that women, infants, and children have access to food and nutritious food. And also another area we haven't talked about on this panel yet is the child tax credit, which we know reduced poverty and child poverty in half when it was implemented during the implementation of President Biden's American Rescue Plan. He made an additional call to action for that through his budget request, and that's another area that we'd love to be able to expand and permanently expand that child tax credit, which we know reduces poverty in our communities.
So important. Thank you for that. Of course, Tina.
I didn't want to leave without saying that nothing that we did on the Sports Council that we could have gotten done without Will and Kelliann and the DPC. And when you talked about policy, when we wanted to get something done and at the leagues or whatever, they're the people we called. So it wouldn't have happened without them, of course, with the CDC. It really is a team effort.
I want to say that Tina kind of stole my thunder because I feel like these two individuals are so brave and so smart, and I've learned so much from them over the last couple of years, and they have done the really, really hard work of bringing so many people together. So I hope that you will reach out to them because they are the change makers in the administration, and I love them with all my heart. Thank you all so much.
I'm going to take the last word here and just give an incredible shout out to Danny, Bernie, Elena, Kenzie. The Food Tank team is so incredible and amazing, and we just appreciate their partnership and collaboration. So thank you, Danny.
I just have to say a few words before our panelists leave us. As Food Tank continues to, in our work to support the national strategy on hunger, nutrition, and health, we will be heading to Atlanta, Georgia in partnership with Spelman College and Emory University. We will be taking a deep dive into many of the themes that we've already explored here in the last two panels and much, much more. If you are in the Atlanta area, I hope you can join us in person. I don't remember the date. April 14th, thank you. And you can go to foodtank.com/events. So for our next panel, thank you again, panelists. Please give them a round of applause.